Hello, and welcome to this episode of The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. I'm founder of Dental Speakers Bureau, Vanessa Emerson, and I'm very excited to be here today with Dr. Gary Sherman. Now, if you don't already know Gary, he has been a dentist for 36 years and also a heart failure patient for 22 years. This has given him a very unique perspective on how today's healthcare professional and practitioner must relate to and understand their patients. He has accrued a wealth of knowledge about disease conditions of the heart and how dental disease and treatment influence and are influenced by those conditions. So I've asked Dr. Sherman to share with us in this episode, and Gary, if you could just take it away, what are the courses that you offer, and just a nutshell version of what do we learn in those courses?
Sure. Thank you, Vanessa. And thank
Sure.
you for having me. So the first course is about the relationship between dental disease and heart disease. And for us, that encompasses many things. It encompasses the technical things about the fact that dental disease, periodontal disease, is indeed related to heart disease. More importantly, in that course, it's also about making connections with our patients in a way that our patients will have much more confidence in us as healthcare providers, because we're going to ask the right questions of them and be interested to know what's going on in their lives. And in today, especially today in healthcare, we have to establish those relationships with our patients. They have to know that we really care about them and positive outcomes.
And what's the title of that course, Gary?
Yeah, so The Heart of the Matter is the title of my overall course. That one is basically the relationship between dental disease and heart disease and why it's important for dentists to know that today.
Got it. And do you have other courses?
Yeah, so I have another course called Gender Matters. That's about women heart disease and the fact that recognizing heart disease in women is different than recognizing heart disease in men. In this discussion, we uncover the prevailing issues on why heart disease is misdiagnosed in women and how the symptoms of heart disease are different in women than they are in men. Why do physicians have difficulty making this diagnosis? How can we as dentists identify signs that our patients might be experiencing heart disease? And we explore it all and more from the viewpoint of me, someone who's been entrenched in the treatment of heart disease for 2 decades now.
They both sound like they're really important courses, and certainly really relevant today. As when we're recording this, we're mid-pandemic, but I mean, like all the time, these are important courses. So I love that you're bringing your experience as both a dentist for 36 years. You've done this for a while as a dentist, as well as someone who's been on the other side with heart disease. And I just love that. I mean, who better to be an expert? And I know from our conversations, you spent a lot of time learning more about the science and the medicine behind heart disease. And would it be safe to say that your courses are a mixture of communication skills and also kind of some leadership for each of us as professionals, and how to approach these conversations, but also a deep dive? It could be a deep dive, if we have enough time, on the science of this and to understand better the science behind heart disease. Would that be fair to say?
It would be fair to say. And the more we know, the more confident we can be as practitioners.
Yeah.
And I think way back in dental school, we studied about the heart, but I will tell you that most of us have forgotten most of that
Sure.
that we've learned. And things have changed, especially in treatment of heart disease. The
Sure.
technology is incredible now. There are devices such as the one that I have. I have a left ventricular assist device that, while it existed many years ago, it was probably the size of a washing machine. And now it's something that I can wear and live with and live my life successfully, pretty much normally. There's some things I can't do, but so to understand a patient who walks in our door, who has what I have, and see them and be glad to see them, because we know we're going to be able to confidently treat them, is important for
Yeah.
me to convey to the dentists.
Yeah, and we can certainly feel your passion for this and understand your passion for this, but also recognize that aside, that this is a super important topic. And I just love that you're bringing this to the industry. Is there anything that would be important for the meeting planner to know before we wrap this up? Is there anything we haven't covered that would be important about your conversation, about your presentations?
The nice part about this disease, and the fact that I'm a dentist and a patient, is that the subject can be directed towards pretty much any audience and for any length of time. And so with that, we can create a presentation that's specific to the audience, as far as how many people and also the level of their experience, and what will help them most in their practices or in their lives when they go back to those lives. And I can do that, as long as I have an understanding of my audience. I'm going to deliver a presentation that they'll come away with a lot of value with.
Excited. I would love to sit through your course. It sounds really fascinating and really
It's fun
important.
too. It's kind of fun too. I make it entertaining. I got a lot of stories, and some will tug at the heartstrings, but some are funny too. But it's just real life, and it's just
Yeah.
us being able to connect with our patients as people.
Well, thank you for sharing your story with us as dental professionals, and thank you for your passion and wanting to bring this to the industry. And for the planner who would like to know more about Dr. Sherman's programs, you can go to dentalspeakersbureau.com, and you can find him alphabetically there, or you can just put in Gary Sherman, just like it sounds, and search, and it'll pull it up. Now, you can also go to his website, which is drheart2heart.net. That's Dr. Heart, the number 2 heart.net. You can find out more there. On our bureau site, we do have information about both of the courses and his bio, and just a whole bunch of information. If you'd like to reach out to me for a little help in connecting you, I'm at info@dentalspeakersbureau.com. And I just encourage you to reach out to Dr. Sherman to find out more about how he could customize a program for your next meeting. So Gary, thank you so much for being here and sharing with us today.
Oh, you're welcome, Vanessa. Thank you for all you do.
You're welcome. Take care, everyone. Be well.